Yes, it is time to ask Dr. Jenny once again, and we've had some questions about getting through the holidays without getting depressed. So if your ho-ho-ho is ho-hum or even a bit sad, it could be something chemical that could be treated. That's the good news. Dr. Jenny, owner of Age Vital Pharmacy, is back with some help for us. This is a kind of a consistent problem with some people when it comes to the holidays. They get maybe a little blue. Some people may even get more depressed, and some even suicidal. Why does this happen, first of all?
I always talk about, number one, there's a lot of deaths, it seems like, during the holidays, and there's a lot of hustle and bustle, and I think so many people put so much pressure on themselves. The gifts, the events, the parties, the perfect tree, the perfect lights, and how much it's like give. It's,
the fact that they don't have that, perhaps,
right, and it
adds that pressure to the situation.
I think we need to be a society that doesn't put so much pressure, on people, especially the moms. I think the moms really struggle during the holidays. What am I going to get my husband? What am I going to get the kids? What I get? Moms seem to worry because of all the hormones. I think we have more hormones. The difference between shooting a gun and throwing a bullet, right?
Right,
Men
exactly.
and women.
So how do we fight these blues that may crop up?
Number one thing that we tell is always, changing diet, add some exercise. These are simple things that they can do. Everybody can change to non-GMO foods, changing to, organic, doing the local farmers in your area, Trader Joe's, Fresh Market, Whole Foods, things like that. Because you are what you're absorbing, The saying isn't you are what you eat, but you are what you're absorbing. And we're not absorbing anything in this country because our foods are all genetically modified. 90% of our crops are genetically modified. So we're not pulling out the essential nutrition to help and support, those feelings of depression, to help prevent all of that. So like the vitamin B12, the amino acids, because everything is so tampered with, the folate, the vitamin D. It's like a chronic condition right now. People just feel sluggish, they feel run down, and they feel blue, right?
Sure.
And they call it the humbug blues.
So is there a way that if you can't get that nutrition naturally, that you can supplement and get it so that you can avoid these blues?
Yep, absolutely. I do have some of my favorite products when people come in and they're like, I need a quick fix, something that's going to get me through, my week. I feel so high-strung. I always recommend my Cardio Fit supplement. That's a supplement that I have vitamin K and vitamin D3 in. Vitamin D is actually a hormone, and it's a hormone that makes you feel good, and it gets you out of pain. And a lot of people get depressed because they're in pain. When you're in pain, you don't want to do anything, and you kind of become a hermit. And so this gets, protects your bones, protects your neurological functions, and it's something you can test for, too, to see what your levels are.
Well, let's talk about the testing, because, that's something that a lot of people don't think about, that they should go and see someone like yourself to find out if they are deficient.
Right, exactly, and it is. What are you deficient in? You can look at your hormones, you can look at your vitamins, your minerals, your good bacteria content in your gut, and all of this plays a role in, in your mood and in how your brain is being protected, how those neurotransmitters are in there, and they control and regulate your mood. If I gave you a shot of epinephrine, what's going to happen to you? Noradrenaline, right? Yeah. You're going to be totally high-strung, jumping around, everywhere. So, and it's the same thing. It's like, what chemicals are out of balance in our physiology that's causing us to manifest symptoms of depression, anxiety, heart palpitations? Because we're so quick to label people as something, but it's really a deficiency. And getting to that root cause is, that's where we need to go. We need to make that shift.
Well, you need to go to Dr. Jenny if you're having these problems, and see her team at Age Vital. And the number there is 888-388-7237 or agevital.com. Thanks, Dr. Jenny.
Thank you.
Be right back.